Washing my hands. Hi, Betty. My name is Carl. I'll be your nurse today. Pulling for privacy. I see the doctor has blood transfusion in your order for your GI bleed that you had going on for a little while now. I do see that you have your sign of consent form filled out, so that's good. Do you have any questions about that? Have you ever had a blood transfusion? Betty says no, and she hasn't had a transfusion before. So, Betty, I do just need you to verify your name and date of birth. And we have Betty Jones, 521 of 52. So I'm going to sanitize my hands, put on clean gloves, and I'm going to check the patency of the line and make sure it's appropriate size, which it is. It's in the 18 to 22 range. It is a 20 gauge catheter we have in the left forearm. And I don't notice any swelling, infiltration, anything that looks out of the ordinary with the IV site. Clamp. And Betty, just let me know if this hurts at all. I'm just flushing through your IV, making sure everything is clear and patent for your transfusion. She says that doesn't hurt and everything seems to be going in just fine. So I'll clamp it off and stop there. Okay, and now I'll proceed with checking Betty's vital signs, checking respirations, notice any gurgling or extra fluid in the lungs. I might want to contact the physician and ask for like furosemide or any type of Lasix. If there's any CHF or high blood pressure involved, I would want to consider that. I'm also going to instruct Betty that during her transfusion, if she notices any discomfort or changes, to let me know. There could be a possibility of a reaction. If that is the case, I'm going to have an extra bag of saline and a clean set of tubing here that I can hook up and run, and I would discontinue the transfusion right away. Have another nurse come monitor you, Betty, while I call a physician and wait for extra orders to go from there. So now I'm just going to get my bag set up. Vital signs are good on Betty. I didn't notice any gurgling respirations or crackles in the lungs. Side. These are both clamped off. Rollers clamped. And I'm going to unclamp the saline side, and I want to fill up the drip chamber so the fluid level is above the filter in here. It has an inline filter. Don't want the blood to drip down and just hit solely the filter alone. It needs fluid to disperse into, which it is full. And I'm going to prime my tubing to get all the air bubbles out of the line. And that seems to be appropriate. I'm going to clamp off the saline. Hitting the line. And I'm going to order for my unit of packed red blood cells for Betty's transfusion.
Hi.
Hello, Nurse Angela. You have my blood for me.
I do. I have your blood here.
Thank you.
Yeah.
And I'm going to check the blood. If there's a facility protocol to have it warmed or an extra filter that needs to be involved in the blood transfusion, which we do not. So we're just going to run with the standard filter that's on here. I'm, tilting the bag back and forth to make it homogeneous gently. Also looking for discoloration, clotting, anything of that nature out of the ordinary. I'm ready to compare when you are. We have
I'm ready, Miss Carl.
Betty Jones, birth date of 5/21/1952.
Betty Jones, 5/21/52.
Okay, and we have a red armband number of 4566 or 456654.
456654.
Okay, we have a medrec number of 224466.
224466.
Location HLRO.
Location HLRL.
Account number 123456.
Account 123456.
Okay, and patient blood type is B positive.
Blood B positive.
Donor pool number 7890.
7890.
Units in the pool 4.
Units 4.
Volume of 250 mLs.
Volume 250 mLs.
Blood component, packed red blood cells.
Packed red blood cells.
And expiration date and time 12/22/2020 at 2000 hours.
12/22/2020 at 2000.
Okay, and donor blood type O positive.
O positive.
And compatibility test completed 7/6/2020.
Completed 7/6/2020.
Okay, thank you, Angela.
You're welcome.
Now I'm going to spike the blood bag.
Let's get that ready. So this way we don't have to have our patient listening to all that extra beeping. All the correct canister open. All these lines are open. The saline mark is open on the arm.
These aside.
Only one is closed.
And I got the saline closed. I'm going to open the clip on the unit of packed red blood cells.
Initially,
And I'm going to
we
flush out the air bubbles and proceed to run the blood down the line until it is just about to the end, without wasting any blood or trying to get any excess fluid into the patient. And for our purposes, we will say that that line is flushed and primed. And I'm going to hook this up to Betty. And I'm wiping in around 15 seconds or per facility protocol to clean the end, not contaminating it after it's been wiped. Then hooking up the line. Okay, I'm gonna unclip Betty there. Roller clamp still on.
so initially
Okay, I'm turning the system on. And new patient, yes. Med surge, well, yes. Oh, our door's giving us a problem again. Sure, it has to happen when I'm doing my video. See? Give me a second, I'll get with this. Hopefully figured out.
we would, like I said, we would make sure that we're assessing Miss Betty here every 15 minutes, staying with her for the first 15 minutes to
Okay, we're good. Sorry about that. Patient ID 1, 2, 3, 4, 5, 6. We'll go with confirm. Channel select A. Guardrail IV fluids. Page down to blood RBCs. Is what we're looking for. Is this correct? Yes. We will start the rate at 50 because we want to start out slow, just in case there is any reaction. After 15 minutes, we can speed that up. If it was a younger child, due to lower blood volume content, we could start out even slower yet. We have 250 mils to be infused. We'll set it at 225. just so we don't get air into the line. And I will start and open my roller clamp, making sure that all my clips are open. Close to the saline, open to the blood. Make sure the infusion is running properly, which it appears to be. First 15 minutes, I want to stay with the patient. Make sure they're not having any reaction. I said shortness of breath, flank pain, itching, anything of that nature. So after that 15 minutes, I'm going to recheck all the vitals, lung sounds, all that stuff, make sure nothing has changed as far as the patient goes and how they're feeling. If everything has gone well, which we'll say in our case it has, I can bump up the infusion rate. I'll change it from 50 to 120, and that's just going off of our ideals training preference, because I don't have an established rate that they want me to run it at. The infusion should go from anywhere from 2 to 4 hours. The blood should not be left out while I'm getting everything set up and ready for more than 30 minutes at room temperature. So I want to have everything kind of set and ready to go by the time the blood gets here, so I can run it, so it's not just sitting there. Now that the blood is running, every 30 minutes to an hour after the 15 minutes that I stayed with the patient, I need to check vitals again and do an assessment on the patient just to make sure that an allergic reaction, any complications are not occurring. If they were, I don't believe I said this, or maybe I did, I would switch over to saline, new bag, new tubing, stop the infusion, have a nurse come stay with the patient to monitor while I go get some orders from the physician. We'll say the infusion is done, patient tolerated everything well, so I'm just going to turn it off for now. Stop my roller clamp. After I was done setting up, I would have cleaned my hands, got some new gloves on before I'm touching all of this equipment, but because I'm going along so fast, I'm just kind of doing things in order here. But I would grab a new wipe and a new flush, because what I didn't do either, now that I'm thinking about flushing, is after my blood infusion was down, I would want it to stop with a little bit of blood in the bottom of the bag. Then I can go back and restart it just a little bit to try and get as much of the blood in the patient as possible, because that's what they need, is the packed red blood cells. Without getting air on the line, then I need to switch over and run saline, so I would clip off my blood, open my saline, program it to run at same rate, 120 mils an hour, total volume of 30, just to get the saline to run all the way down, clear out the rest of the blood that's left in the line and get it into the patient. I forgot to go through and do that, but now that I'm done with my infusion and I ran through the line, I'm going to go through disconnect. I would discard all of my blood tubing and bags. If anything was saturated with blood or anything, it would need to go into biohazard, but it's fine to just throw it in the garbage. So I'm going to clean off the end here. This is all post transfusion, 15 seconds-ish, let it dry a tad before I hook up my flush. And now I'm just going to flush through to make sure everything is cleared out of the line and the line stays open. Clamp it off, disconnect, clean up all of my mess here, get everything situated. I would need to document the start and stop time of the transfusion, patient's vitals, how well it was tolerated, the venipuncture site, the size of the catheter, I believe I need the donor pool number and the blood type, and that would be it.